So, this video addresses a very important topic of preconception health and nutrition. So, there are a series of risk factors for adverse pregnancy outcomes which can be prevented effectively through preconception care. So, women should ensure an up to date vaccine status of rubella and hepatitis B, as well as adequate treatment of maternal illness such as hypothyroidism. And regular exercises can help to achieve a normal maternal body weight before pregnancy. And preconception care should be an essential part of primary and preventive care for all women of childbearing age. So globally, women in their reproductive years, including adolescents, should receive good counseling and advice in order to promote good health, optimal nutrition, and lifestyle. Stop smoking and increase physical activity. A healthy dietary pattern, as is recommended for the general population to a large extent, also suffices to meet the nutritional needs of pregnant women. However, specific nutrition and the avoidance of specific lifestyle factors are particularly important to address even before conception. Hi dears, do you know that the basis for embryonic and fetal movement or fetal development is already set prior to conception? And it is subsequently modulated by nutritional lifestyle choices throughout the whole course of pregnancy. So that's how it works. So this is known today as the developmental origins of health and disease. Hunger winter. So during the Second World War, the west of Netherlands was blocked from food supplies for a limited period from November 44 until May 45. At the worst times, the rations were as low as only 400 to 800 kilos per day. So for example, one daily ration would have consistent only 2 potatoes, one slice bread, and half a sugar beet. So this was during that World War II time. So despite the tremendous challenges that existed during the war and this hunger period, one hospital in Amsterdam kept on noticing precisely the outcomes of prenatal hospital visits and infant births. So when explored these extremely valuable data, depending on the duration which starvation occurred, the outcome in the offspring differed markedly. So that is very interesting, right? So as stated before, when a significant reduction in energy intake occurred during the first trimester of pregnancy, later obesity, diabetes, and heart diseases in the offspring was markedly increased. So the data of Betz famine showed that early deprivation of energy and nutrients shortly before conception and during the first trimester is associated with markedly increased non-communicable diseases in adult life than compared to exposure of starvation in late pregnancy. Moreover, maternal underweight is associated with an increased risk for certain adverse pregnancy outcomes. This includes preterm births, low birth weight, gastroschisis when compared to women in a healthy weight. Women, but also men of reproductive age, should be encouraged to consume a healthy diet as recommended for general population. So, following a healthy dietary pattern is sufficient to meet most of the nutritional needs of women during early pregnancy. There is another research that shows that exposures and experience during early life can induce epigenetic modulations to the genetic material contained in the oocytes and sperm, as well as in the fertilized egg.